Welcome to 12 to Your Health. I'm Dr. Derek Da Silva. Well, many people with bone, muscle, or nerve injuries may not know that surgery is not the only option. Platelet Rich Plasma, or PRP therapy, could be the solution for you. Here to explain it is Dr. Richard Braver. He's a podiatrist at Active Foot and Ankle Care in Englewood. Thank you so much for joining us.
Thank you for having me.
You know, PRP is not new, is it?
No, it's been around 10 years.
And what is PRP?
It's a method where we take some blood from the arm, put it into a test tube, centrifuge it down, and the red blood cells go to the bottom, and the plasma goes to the top, and we simply take that plasma out and re-inject it into an injured area.
That plasma, what makes it so special?
Well, plasma is full of platelets, and when platelets, which of course stop bleeding, but there's also another component where it sends out proteins. We call that growth factors, and we inject it into an injured area, and that promotes healing.
So we've got a picture here. So you take the top part, that yellow part, you extract that, and that's what you inject into the joint.
That's either into a joint or into soft tissues like tendons and ligaments.
Okay. Typically, what type of injuries are you looking at that this therapy would be applicable to?
Well, the most common injury in the body is really plantar fasciitis. That's strain on the bottom of the heel. It's also good for Achilles tendon problems. Any tendons around the ankle joint. It's good for knee injuries such as patellar tendonitis. Some people use it in the ligaments called the ACL of the knee. It's good for tennis elbow, golfer's elbow.
Any risks, downside?
There's very little risk because it's a natural product. It's your own blood, so there's really virtually no chance of rejection, no allergies, no rashes.
So somebody goes to the doctor, they have a tennis elbow, they've got golfer's elbow. Is this an option? I mean, where does this fit in as far as other therapies go? Is it the first line? Is it a second line?
It's in chronic injuries. It should be a first line because it converts a chronic injury into more of a fresh injury to allow the body to heal itself.
So by stimulating and giving it growth factors is what promotes the healing within that joint?
Exactly. Part of the inflammation process is that your body sends growth factors down to the area. So here we're taking blood, taking out the growth factors in a concentrated form. So we take 5 to 7 times the amount of growth factor, inject it in the area to stimulate and enhance healing.
Wonderful. Thank you so much.
Oh, my pleasure.
Thank you for joining us today. And folks, once again, here's what we're working on for next week. And remember, you can catch 12 to Your Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. Well, it's time now for your Health Bite of the Week. If you're planning on spending the day at the pool or at the beach this summer, staying hydrated is absolutely the key. Here's a tip. Pack an insulated cooler with cold water bottles and water-rich foods like fresh fruits and celery sticks. And once again, I've got the answer to another common health question, and people send me this all the time. What is the difference between good and bad carbs? Good carbs are complex carbs, beans and peas and things like that. Bad carbs, white bread, white flour. Stay away from those white products. And once again, if you have any health questions you'd like to ask me, email them to me at 12toyourhealth@news12.com. I thank you once again for joining us today, and here's a look at this week's Community Health Calendar.